make a start anyway. So thank you all for coming. We are going to obviously be doing this webinar for the next hour and a half, and it's also going to be recorded. So we've got quite a few different people with us today. So we have Tricia Madden from Education Scotland with us, Kelly McGarvey from the Care Inspectorate, Tracy Palmer, also from the Care Inspectorate, and myself, Sharon Reynolds. I'm the Service Manager for Methodology from the Care Inspectorate. So we're all going to be doing a bit of presenting and be available for your questions and answers. So the chat function is there and working. We'll put some links in the chat at the relevant points in time. We are going to be using the AHA slides, and when you start using those, the presenter will talk you through that. Please do feel free to put questions and things in the chat, but we will be addressing those at the end of the session. So we'll have time for question and answers at the end of the webinar, and hopefully we'll be able to get around to answering quite a few of those. We most likely won't manage to answer all of your questions during the course of the session, but what we will be doing is we'll be pulling those together in a frequently asked questions document, which we will send out with the next provider update, provided that's not next week. So what we will also do is we will share the recording of this and also share some of the slides as well. So you will get all of that along with the frequently asked questions documents via the provider update. So I'm going to hand straight over to Tricia, and she's going to start the session off for us.
Sharon, Tracy, can you move on the slides, please? So, evening everyone. As Sharon said, we're going to focus on self-evaluation tonight. So the aims for today is to learn a bit more about self-evaluation, gain a better understanding about how you can use self-evaluation in practice, and share experiences and learn from others. And we know that sometimes self-evaluation can be a scary word for people. So hopefully after the session tonight, people will feel a bit more confident in terms of their own recording of self-evaluation. Can we move on? Thank you, Tracy. So just before we launch into tonight's session, we thought it would be a good opportunity just to give everyone a wee update on the framework development. As you know, the digital framework was developed and designed in October last year, and we undertook a lot of user testing internally and externally. And following that, we used the feedback to make some changes. Obviously, in terms of the digital framework, I'm sure that people who have been able to see it so far, you'll note that we've reduced the number of quality indicators from 28 down to 11. We've reduced the duplication where appropriate. And we've also created that sector-specific content. So there is, the framework has split into three. So we have the ELC part of the framework, we have school-aged childcare, and we have childminders. And that's something that was a big ask from the sector. And following the user testing, we then held 11 online engagement sessions. That took place over November. During that, we had over 2,500 people attend, and really that was a familiarisation sessions, really just to get people aware of the fact that the framework was coming and what it looked like. So following that, we then released the digital framework in January 2025. And again, following that, we decided that we would pilot the framework's quality indicators across February, March and part of April. And we're grateful to everyone who volunteered to be part of the pilot. Unfortunately, we couldn't take everyone up on their offer. However, we did have over 70 settings that we visited. And during that pilot, we piloted all of the quality indicators. We carried out single inspections, Care Inspectorate carried out inspections, HMI carried out visits, and then we carried out some shared inspection visits. And during that time, we gave people the opportunity to have the choice of a quality indicator, and that was something that was really welcomed by the people that we visited. So what we've done is we're building on all of the learning that took place during the pilot, We've held some focus groups following the pilot, and we've used MS forms to gather information. And we're using all of that information as we develop the next stages of the framework. We also, during February and March, held some engagement sessions. And that was really just to give everyone an update on the framework, but also to give people the opportunity to comment on our current inspection methodology, what works well, what people think we could do differently. And again, these were very well attended. During that time, at the end of the sessions, we asked, is there something else that people would like? And self-evaluation sessions was something that people would welcome, and we're here tonight, and thank you all for joining us. We also had a session this morning, and we had in-person sessions yesterday. And we plan, as we move forward, to have further engagement sessions across the next coming months. And finally, in September 2025, we will be using the Quality Improvement Framework for Early Learning Childcare sectors in inspection, and that will be Education Scotland and the Care Inspectorate. And just to make people aware, from September we will not be focusing on how good is our early learning childcare or the quality framework from the Care Inspectorate. We will only have the one framework, and that will be the Quality Improvement Framework. So that's just a brief update, and I'm going to pass on to Kelly now to take you through the next part of the session.
Thank you very much, Tricia. And hello to everybody. As has been said, my name is Kelly, and it's great to be here on the webinar with you all, and amazing that so many of you could join us tonight. I think the last I looked, we've got over 500 people on the call with us, which is just amazing. Now, based on that, with having over 500 people on the call, it makes it a teeny bit difficult for us to interact with each of you individually. So what we have done is we have built in opportunities for you to interact with us throughout the session, keeping it engaging as well as informative. And one of the ways in which we're going to get you to interact with us, as Sharon mentioned, is through the use of AHA slides. So I could already see, as Tricia was talking, that a few of you have managed to get onto the slides, which is great. But for those of you that haven't, let me talk to you a little bit about how you can do that. So if you go into the chat function, you'll see a ribbon at the top of your device, whatever you're using, and you should see a button that says chat. If you press that, you will see that there is a link in there that Victoria has placed for you to access the AHA slides. In a wee minute, we're also going to show you a QR code so that if you have another device with you that's got a camera, you can use the QR code to access the slides as well. So either click on the link or the link in the chat, or you can use the QR codes. Once you have access to the slides, you'll be able to see what's in front of you on the screen and be able to have a look at them through another device, but you'll also be able to interact with us live during the session and let us know what you're thinking about the questions that we pose to you. But don't worry, we will let you know the points where we want to hear your thoughts or reflections. And your interactions with us are incredibly valuable because they'll shape some of the direction that we take. We could not possibly highlight and discuss every contribution that we get tonight, but what we will do and aim to do is just to go through what's shared with us and really pull out those emerging themes. And what's quite helpful and beneficial with the AHA slides is you'll be able to see what other people are commenting and what they're putting. So you might see some commonality or some differences as well. So there are lots of benefits to them. But it's worth noting that the contributions are anonymous. So your name doesn't come up when you're putting things in. So it'll just tell us what your thoughts are. Okay, so to get us warmed up and so that we can make sure that all the technical side of things is working, I'm going to ask you a few questions just now. So we'd really appreciate you answering them for us. Next slide, please. So the first question is around your confidence in self-evaluation. And straight away, I'm seeing people are getting in there and giving us the answer. So to get us started, we're asking you to tell us, how confident are you in using self-evaluation? Are you very confident, confident, somewhat confident, or not confident at all? And as I said, these are anonymous, so the right answer is the honest answer. And what we're going to do at the end of the session is we're going to revisit this question. We're going to ask you again. Now, that's one of the ways for us to do a wee bit of evaluation ourselves, an evaluation of the session. So what we would hope to see is an increase, or at least certainly not a decrease in people's confidence. If we see a decrease, it would tell us that something in this session needs to change. We will also be asking for feedback, specific feedback from you as well. So we'll be looking at that to think about what's worked tonight, or if something hasn't, let us know and we can work on that and make improvements going forward. I can see already good few of you have been able to get into the slides and are able to answer it. And we're seeing that the majority is sitting in those kind of middle areas, confident and somewhat confident, and that's what we would expect. We've got some people who are very confident, and there are lots of different reasons for that. People might be very clued up on self-evaluation, just feel really confident where they're at and know they use that on a daily basis or more regularly in the service. And there are some of you that just are not feeling at all confident when it comes to self-evaluation. And what that might be is you just don't realise you're doing it. And we would hope that that's something that you get a sense of by the end of this session. Okay. So the responses have slowed down. Thank you very much for your contributions there. We'll move on to the next question. Can I have the next slide, please? Okay, so now we're asking you to start to reflect a little bit on your service. Now we want to hear from you. What is good about your service? So you might be a childminder who's thinking about the best aspects of her service or his service. Share that with us. You might be part of a team, either in school-age childcare or in a daycare. What are you really proud of? What's good about your service? Okay. So we're seeing staff and the team coming up. And there'll be lots of things that's specific about that. So people might be thinking about the staff team and how they work together, or the skills that sit within a staff team. And there's somebody's been specific about how people work well together and the teamwork and pulling together. That there's people are seeing a strength is that their setting is welcoming, and actually explored that that's about good communication within their setting, and that's something they're proud of. Partnerships with parents coming up, and you'll begin to see those common themes emerging. So we're seeing partnerships with parents, nurturing family engagement, and again some stuff around the team and how people are working well together. It's really important, isn't it? And someone's put there what's really good in their service is a sense of people who genuinely care. So that ethos within a setting, and you can feel that. The environment, that's come up a few times as well there. So people are really proud of the space and that they provide to children, or what they've created in their environment. And that might be your whole environment, might be that you've got a setting that's developed the outdoor space, or it might be a particular space within your indoor environment that you're meaning there too. So if we can do a wee scroll down or a click to the other page, just to make sure I'm picking out all those emerging themes. So the room team, so that's somebody really drilling that down to the team that they're working within, and then connections with children, of course. That's great. That's exactly what we want to be seeing. And those themes again around relationships. And then someone has said there about their good outdoor learning opportunities. And there's one, a flexible service to suit families' individual needs. So somebody really proud about that flexible service. And I'm sure the families are very appreciative of that as well. Okay, and the reliability of the service, absolutely crucial for families and parents, isn't it? And that consistency for children. Okay. So hopefully you're beginning to see there that there's a lot of common themes that we celebrate about our services. And I'm Going to move us on to the next question now that we have explored what we think is really good about our service. Oh, there's something there, our philosophy around how children develop and learn. That's a really important one, isn't it? So feeling confident that staff know what's underpinning their practice and these are clear about your common approaches as well. Love that. Care and love for children. Because we love the children within our care and it's such an important thing. And again, working well with families. And it's really reassuring to see that coming out because actually, that's such an important aspect when we're caring for children is recognising that to offer quality, we have to think about it holistically. And in order to do that, we've got to be working closely with families and having that good communication with families too. Okay, that's great. Thank you so much for all of those contributions. It's really lovely to read all of those positive aspects of practice. So if we can go on to the next slide now. What we're asking you to think about now is what could be improved. So we're not asking you to think of something that's bad about your service necessarily. It could be just that there's something that you think is good, but actually you're aiming for excellent. What kind of aspects of your practice service do you think could be improved? Okay, so paperwork. Paperwork's coming up. And I was going to drill down in that, but somebody else has done it just underneath and has highlighted less paperwork. We hear that all the time. And actually, we hope some of the key take homes from this session is about you being more confident about what's important in terms of some of that paperwork. Yeah, absolutely. That's coming in really strong, that's something for all of you that you'd want to improve. And it is about thinking about what is helping us, what paperwork is actually helping inform our practice and tell us things about our service and telling us things about our children so that it's meaningful and it's valuable. Okay, so that's somebody saying that they think that having a shared pedagogy throughout the team would be something that could be improved within your setting. And it's not dissimilar to what somebody said they were proud of within their setting when they were saying that they have a clear philosophy about what's guiding their practice. It is helpful to have that, absolutely. And then we have the staff team being more confident and using a rights-based approach with the children, being confident to support children and understanding their rights. And these great aspirations to have and areas of practice to be focusing on and thinking about developing. Yeah, too much paperwork. Hear you on that one. We absolutely do. So people are telling us closer partnerships, working with nursery settings for blended care, funded placements. Okay, yep, that's a really important one, isn't it? There's some complexities there when you have children who are cared for within different settings, but absolutely important we have good communications between those settings to make sure that, again, there's that consistency of care for the children. People are putting here outdoor learning would be something you would want to develop. Providing evidence, which is the best way to do this. Okay, so we are going to explore some of that on the session tonight, and that's some of what we're going to be thinking of. So if that's somebody thinking what could be improved, you're in the right space. We're going to get you thinking about your self-evaluation and what you might gather. Okay, again, paperwork. Lunchtime, feeling rushed, children struggling to sit as they aren't used to sitting, supporting the children who become overwhelmed. And again, that's about that what other people have talked about, isn't it? Having those clear approaches and feeling confident about how to support children in those situations and the courage to make changes to practice to make things better based on the needs of children. And they vary, don't they? You have from one year to the next, you can have completely different sets of children with different sets of needs. So we need to be responsive, don't we? stability in staffing to improve consistency with high quality. So we absolutely understand that there's been real challenges in terms of staffing, and we don't have magic wands. We absolutely understand that, but it is thinking about, maybe there are bits of work we can be doing at the local level that you want to do to improve things for your existing staff teams. Less paperwork. So I'm definitely getting the clear message about what we'd want to improve is less paperwork. And what's not being said is that you don't want any paperwork, but I'm getting that sense of that it would be meaningful paperwork, stuff that's actually supporting you to do the job. So you've got more time with the children. Workload for practitioners. And I would hazard a guess, although these are anonymous, that actually that paperwork message is coming in from people in varied roles. So whether you're a childminder or a practitioner, a manager, that's something we're always battling with. Okay, thanks very much everybody for your contributions. If we can move on to the next slide, I've got one more question for you before we move into the session. And stuff there about staff deployment as well. Okay, so you've given us lots of really rich contributions there about what's working well and what could be improved. Now tell us, how do you know this? How do you know that that's what's great about your service? And how do you know what needs to be improved? Feedback from key stakeholders. Yeah, so listening to the people that use our service. Feedback, observations. Very powerful in early years. Observations of practice, but also observations of children. Some of us are working with children who can tell us their thoughts and their wishes and their wants. Some of us are working with an age group that we really need to observe how they're interacting with the environment or how they're interacting with others to communicate with them, because they aren't communicating with us verbally. You get parents' feedback, family feedback, parental engagement, checklists. So some of those systems, audit systems for you to check that things are happening the way you think they should be happening. Staff surveys, so actually asking targeted questions to people about how things are, and there's lots of ways you can do that. It can be quite focused, direct questions, or you can be asking people to give a measurement of where they are, a bit like what we did at the start of the session around confidence. Children's reactions to different things. Yeah, So when we make those changes, building in the observations to just see how that's landing with the children and what they're telling us by the things that they do as well as the things that they say. That's an interesting one. People put out, and again, I think that links back into observations that, when the children are appearing overwhelmed, what's that telling us? And being curious about that and asking a little bit more. Someone has happy children and parents, and there's lots of ways for us to check that. We can ask people directly about that. Again, go back to those observations. Reflections from families who use the service. The staff's voices as well. Absolutely, staff's voice is vitally important too. That you can see it. You can see things are going well. There's someone talking about how they use a WhatsApp as a way of communicating with people and getting feedback. Yep, I can see how that would be effective as well. I can see how that would be effective both as a parent and from a practitioner's point of view, because if you were just maybe asking a couple of questions directly to families, you would get those responses. Feedback from parents. Visually and through, so people are saying visually, like observing, so it might be through a lack of children's engagement, or it might be actually the reaction children have to things that are put out and invitations to play might be really positive. And we're always making those judgments, aren't we, about it's time to move on, we've lost the children's interest in something and they're needing a wee bit of challenge. So thank you very much, everybody. That is great contributions and absolutely what we would be expecting. Staff morale and mental health. So knowing your teams and knowing how people are doing, and that can often be how they respond to you. Okay, and reflections from staff. Okay. Listening to children and families. Yep. And it is someone's put there through the hard work and listening. It's not always easy. It's not. But what we hope is that you have some inspiration tonight about how we can make things easier. Again, team morale coming up. You really can feel that, can't you? When people are low or overwhelmed with things, and when it's across the team, because we can all have individual periods of time where things are not going as well as normal, but when staff morale is low, that's normally an indicator of needing to make some changes, isn't it? And observations. Okay, so again, thank you so much, everybody, for your contributions. That is a fabulous start. What you've just demonstrated is self-evaluation and what it's all about. We have been reflecting and you've been honestly sharing with us what your strengths are, what your areas for growth are. So I'm about to hand you over to Sharon and Tracy, and they're going to do a bit of a deeper dive into what self-evaluation is, share some examples of how you might approach it and why it's so important and beneficial to you and others, although you're already demonstrating lots of that self-evaluation already. But what we hope is that by the end of the session, you're feeling more confident in your self-evaluation so you can identify meaningful and impactful improvements and where to direct things. Or perhaps you'll be leaving feeling affirmed that actually you're on a steady self-evaluation path, that this has just affirmed that what you're doing is in the right direction. So hope you enjoy the rest of the session, and thanks for your contributions there, everyone.
Thank you, Kelly. So, as Kelly was saying, I hope that was useful in showing you that, you're probably already doing all of this. You know what's working well, you know where you need to improve, and you're clearly identifying some of those activities that have helped you come to that conclusion. So that is self-evaluation. Sometimes I think we need to point this out to providers. This is not something new or something big and scary that, suddenly you're being asked to do. It is part of what you do every day already. Sometimes it's just putting that formal structure around it, just formalizing some of the activities, making them really work for you. And I noticed one of the answers in there was, really clear in terms of, make there be less paperwork. That would be great. That's one thing we'd like to improve. And somebody in one of their answers used the phrase meaningful paperwork, making it work for you, making it do something. Absolutely, I'm all for that. So self-evaluation, we're going to give you a quick overview, a bit of a breakdown of the questions that we use. So as we've said, self-evaluation is that really key thing that's going to be part of driving that continuous improvement, helping people get to those outcomes they really want to get to, identifying what you're doing really well and where those improvements need to be made. So the way that we do self-evaluation is through the use of the 3 questions. So this is all about the kind of theory of self-evaluation. So your 3 questions there along the side: how are we doing? How do we know? And what are we going to do now? So they are the 3 questions. That is what we base the process of self-evaluation around. Very simple. Hopefully you're all working like this. So we're focusing on specific areas of practice, identifying, what contributes to our decision making in terms of how we're doing, and highlighting ways that we can move forward with that. So we're going to break those down a little bit further so that we can kind of unpick each one a little bit. So that first question, how are we doing? So this is really key, is deciding, well, what do you want to know? What is it you're looking at? So that might be something really focused. It might be something that you've heard through some feedback that you want to make improvements on. Maybe a parent's spoken to you, or children have highlighted that something's maybe not going the way that they want it to, or that, you know, that a change is required. Maybe it's been us. Maybe you've had an inspection and we've highlighted some areas for improvements that you need to work on. Sometimes it's not about where it's come from, it's about knowing that it needs to improve. So you've got an area for focus. So understanding what you want to find out is really key at this early point, because that's going to help you decide what questions you ask. When you're finding out that information, you need to be really clear. What is it you want to get out of it? Because that'll help you be really clear about who do we need to ask, who do we need to involve, what kind of evidence do we need to gather, how are we going to measure that, how are we going to know if an improvement's been made. So for this question, most people decide to use the 6-point rating scale. I think mainly because some of that criteria has been defined. So, you know, there's criteria there for what each of those numbers means in terms of how well you're doing. People find it's easier to do that. We're not saying you have to do that, but just some people do find that that's an easier way to do it, having that measurement that's already there and available for you to use. So being able to say, oh, okay, we know we're very good at this, or we're maybe, you know, weak at this, whatever it may be. And then you're going to go through that self-evaluation process. And at the end of that, come back and reevaluate that. Did we make a difference? Did what we, you know, do actually have an impact? Have we made things better? So being able to measure it from the start is really important. The next question, oh, sorry, about this one, the next stage of that question is about gathering your evidence. So lots of people, like say, spoke about some of this is about your paperwork. Understanding what is contributing to that evidence. How are you gathering that evidence? What have you got already? We're not saying to make more paperwork. We're saying make use of the paperwork that you have. What are you already doing in your services? You've already identified lots of things are happening in your services. You're engaging with people, you're doing observations, you're reflecting, you may be doing audits and quality assurance type tasks. All of this is evidence for how well you're doing. So recognizing what you already have and making that work for you is really, really key part of your evidence. So I think somebody had put a question in the chat earlier about local authority and things they already do for that. And is there going to be an expectation that you're suddenly producing separate things? It's not about producing separate things for separate people. It's about your evidence doing the job that you think it's doing. So if you have evidence to support your self-evaluation, then that evidence will be the same for anybody that's looking at it. Sometimes it doesn't quite do the job that you're wanting to do. So maybe you have audits, but maybe they're not quite what you need them to be. So maybe you tweak them to get more out of them. Adjust what you have. Don't always kind of go back and start again. Some of it's about just tweaking what you have to make it work better for you. So lots of different things that can be that evidence. And that evidence is for you to inform your decisions and your evaluation of where you're actually at. Getting feedback, one you'll all know lots and lots about. So obviously, you know, we've got different ideas there. You'll be doing lots of these things yourselves. As long as you are getting feedback, that is really important, knowing who your stakeholders are, whose views are important, you know, who do you really need to be asking questions of or making observations of. We've got various ideas there, recognizing that actually one size doesn't fit all and different things are going to be appropriate for different people depending on your service, depending on who's using your service at whatever point in time. What we always tend to say is, you know, don't be too concerned about the response rate that you're getting. If people aren't responding to the ways that you're trying to interact with them, sometimes that's more about them, as long as you are offering opportunities. When we say opportunities, we mean meaningful opportunities. So it's about making sure that you're considering, should we do this in a different way? Can we provide opportunities differently for different people? Are we making sure they're accessible? Thinking about different ways of actually presenting options for people. So if they have the opportunity but they choose not to take it, well, that's engagement, that's participation. They've chosen not to take it, but they could if they wish. So don't get too hung up on that kind of response rate part of it if you are clear that you're offering it in every which way that you can and you're continually reviewing that. So question 2, the how do we know? So we've spoke there about things like your quality assurance activities, your audits, your questionnaires, all those involvement activities that you're doing, all of those contributing to that question. You're looking at that evidence that is identifying how you know where you're at. The key thing here is the benchmarking from the quality framework. So the framework is telling you this is what very good looks like for your service type. This is what weak looks like. Those are your benchmarks. It's there, it's written in black and white. That is kind of your benchmarking. All of those quality illustrations that you're going to use for that, they've come from legislation, from good practice, from all different places. They have come together to give you a really practical idea of what very good and weak look like. So it's out there, it's transparent, it's written down. It's not somebody's personal view of what good looks like. That's the agreed definition, should I say, or practice illustration of what very good and weak look like. So do use those illustrations as ideas. Obviously, not all illustrations are going to be relevant to everybody, but the primary function of this framework is about self-evaluation. So do utilize that when you're looking at, well, how well are we doing? You can judge yourself along those lines of very good and weak. Evaluative writing. So when we're talking about how do we know how good we're doing, often we focus on inputs and processes. We need it to be a step further than that. We need you to consider that so what question. Just because you have something in terms of evidence, so say example, a policy or a procedure, just the fact that it exists isn't enough. It needs to do something, it needs to mean something. So you have a child protection policy, so what? Is it being used? Is it accessible? Do staff understand it? Can staff use it? Has it successfully been used? Like I say, all those different questions you need to consider. So what? What does that mean? So we've got some examples here in terms of those inputs and processes that we're talking about and asking that so what question. So identifying what comes next, what is the impact, what is the outcome, what did it mean, why was it necessary? What we also have here is some examples of that evaluative language. Now we keep saying to people, these are examples. They're just things we've pulled together. They are not endorsed by Care Inspectorate. They're not endorsed by Education Scotland. They're just some examples to give you an idea of what we're saying to kind of highlight our point. We're asking you to evaluate your evidence. So pulling it together, pulling all those individual things together and making it mean something, asking, okay, so I've got audits that are telling me something. I've got, feedback from people. What exactly is that saying? When I add all these things together, what is it telling me? It's telling me that all this evidence has said this. Feedback from parents is telling us this. So rather than saying, well, we have it, we did the task, tick, we're done, you need more. It needs to mean something. You need to be clearer about what the outcomes are and what the impact is. So question 3, the what are we going to do now? So this, in theory, should be the easiest of all the questions to answer because you've got the answer ready-made. If you have answered those first 2 questions, you've arrived here. You've got the information. By understanding where you're at, what's happening, all that evaluation of the evidence, it will have highlighted for you what's going really well and what's not going so well and maybe needs to improve. So like I say, hopefully this is the easiest of them to answer. From that stage, you're going to be able to then develop your improvement plan. You'll have all that evaluation of your evidence. The gaps will be clear. You'll then be able to look at those gaps and say, right, okay, how can we fill those? How can we identify some actions that actually are going to make an improvement there? And from that, you go on to do your improvement plan. So whilst that's the kind of overarching theory of those things, we're going to help you put it into practice now, and Tracy's actually going to take you through a worked example. So using these questions related to an actual practice scenario. So I will hand over to Tracy.
Thanks very much, Sharon. So my name's Tracy, and I'm going to take you through the next part of this and just apply some of what Sharon's talked about to a worked example. I'm also going to bring Kelly in just for some input just on the AHA slides that we're going to go through as well. So for the worked example, we have picked one of the quality indicators from the new shared framework, and the one that we've picked is the safeguarding and child protection quality indicator. And the reason that we've done that is because that is the one quality indicator within the framework which is shared between Education Scotland and the Care Inspectorate. So we thought, since this is a joint event, this would be a good one to use. The worked example is based on a setting that would have a kind of larger staff team. So if you are a childminder, some of this maybe wouldn't apply to your setting, or it might be that you might do it, but you might do it on a smaller scale. So just keep that in mind just while we're working through it. So if you've looked at the new framework, you will probably have seen that there are challenge questions at the end of each of the quality indicators, and those can be used for lots of different things, but they're a really good tool for support and self-evaluation, for giving you that whenever Sharon was talking about thinking about what it is you're going to look at and setting those parameters. So those challenge questions are a really good way of doing that and helping you to think about where you're going to look for evidence, what kind of feedback you might gather and how you might do that. So for this one, we've picked out 3. There are more than 3, but we've just picked out 3. Again, you don't need to use them all. You could use one. You could just use anything that you want. You don't need to focus on these, but for this example, that's what we've chosen to do. So in this service, we're going to look at how it is that we ensure that staff, including any visiting staff, understand the arrangements that are in place to keep children safe, and how they're kept up to date with safeguarding practice and the national guidance and legislation. So you probably, in your setting, you have lots of things in place already that help you to do that you're already starting to think about, hopefully. How do we ensure effective partnerships with all parties, so staff, families, external agencies, and all the stakeholders that are involved in your setting, and how you can work well with those people to ensure children's safety and well-being. And then also to think about how the setting is supporting children and their families to ensure that the children are safe, secure and protected from harm. So a lot of that's about those relationships that you've mentioned already and about how important that is. So it's about how does that support the protection of children in your setting. So I'm just going to bring up the QR code for this. So what we want you to do here is to think about, if this was your setting and you were going to self-evaluate, you'll have some things in your mind already, I'm sure, but what kind of evidence could this setting use in terms of what could they gather, what could they use that was already there, what kinds of feedback could they gather, what methods might they use for that? So what are the different ways you could get feedback if you were looking at this safeguarding and child protection quality indicator in this setting? So just give you a few minutes just to start and populate your thoughts there. So staff training logs, absolutely. So you could look at staff training around protection. A few people saying that. Child protection certificate. Kelly, I don't know if you know what that is.
I'm not sure. It
Not
might
sure.
be a certificate from training.
Yeah,
Yeah,
possibly.
possibly.
Staff meetings, absolutely. Chronologies, yep, definitely. Looking at those records, checking that things have been recorded and followed up on, followed through. Meetings with other agencies, so yep, getting that feedback. You might have regular meetings that you're doing anyway, that there might be an opportunity just to ask some questions, just get that feedback at the time. The key message of this is just trying to use what you're already doing, not creating a new system or a new process. So policies, risk assessment, staff induction. So yeah, looking at all of that and thinking about how do we think about safeguarding and child protection within that. Staff and family surveys, child protection, yep, reviewing the protection policy. So is the policy up to date? Is it, do people know what's in it? Is it being applied? Is it working? Is it accessible? So all of those questions around that.
There's one in
Wellbeing
the chat
checks.
as well there, Tracy, that's a good one to share, and that's picking a part of a policy and discussing it with staff. So really getting underneath it and having those professional discussions with people and just making sure that everybody's interpretation is right. So I think that's quite an important one, isn't it? It's one thing having the policy, just making sure everybody understands their role and responsibility within that. It's really valuable.
Yep, so somebody's mentioning Samoa. I can't help but picture the wee elephant whenever when I hear that. So absolutely.
That's absolutely, isn't it? That is that safeguarding. So it is about those formal measures that we have in place to protect children when they are at risk of experiencing harm, but also actually some of that safeguarding side of things about making sure that our settings are safe as well, and that we keep children safe. Someone in another session actually suggested we should put a link for the Keeping Children Safe Samoa practice notes into the framework, which was a good suggestion.
Something that you can do going forward, Kelly. So do you know who all the child protection officers are? Yep, absolutely. Family voice through questionnaires. Yeah, somebody else had mentioned there about family engagement as well. Policies. So yeah, lots of things here that, and these are not things that you would need to go and implement, or these are things you're already doing. You're already got this information available to you. It might just be that you tailor what you're doing slightly just to get that feedback about this area of practice that we're looking at. So again, we've got staff training, chronologies, staff induction, annual child protection, so that refresher training. So sometimes people, they have their training when they first start, and it's about keeping that refreshed and up to date so that their knowledge is current. Practitioner CPD, so that development of your staff, thinking about it whenever you're doing one-to-ones with them. We've got quality assurance calendar, so making sure you've got a plan for doing these things and that you're keeping to that, and absolutely scheduling them in, because it's, life is busy and things can be missed. It's very easy that happens. Observations based on scenario indicators, absolutely. Yep, so we've got lots of people saying training questionnaires for staff. So can be questionnaires in paper form. It could be an online survey, which they're great because they analyse everything for you. You can even use AI for doing that now, which is even better. So yeah, training, child protection folders, policies, procedures. So yeah, absolutely. I think if fairly confident looking at this that people know what they could go and look at if they were going to self-evaluate using this quality indicators. That's great. And yeah, training, CPD, visitors logs, care plans, staff meeting regarding child protection with scenarios and a small quiz to gauge gaps in practice. So absolutely, people can complete training, but it doesn't mean to say that they've always taken away the information or have retained it, or maybe it's just about how does that apply to our setting. Sometimes it's kind of generic content and it's like, well, within the context of our policy, what does that mean for us? Child registers. Okay, lots of working with other professionals, developing relationships. Relationships is key to all of this, isn't it? Chronologies, more people saying chronologies. Staff training, review policy as a team. So yeah, get other people involved. It's lots, the more eyes that are on things, the better. Get different people's point of view.
A few people have mentioned personal plans or refer to them as care plans as well. So making that link between things like their chronologies and looking at the personal plans, is all that matching up? That's another good point.
where you're identifying a risk, have you got plans in place and strategies around that? Absolutely. Training logs, SSC registration, yep. Policy procedure. So lots and lots of good suggestions here. Absolutely. And you can see, if you think, when you look at this and you think back to those challenge questions, you can see how that links, and it's a good starting place for thinking about it and how you might take it forward. Okay, and I think we've just maybe got one more page here. So yeah, knowing different aspects of abuse. Yeah. Noting any bruises on board. Yep. So that, just that, having that oversight, you know, just keeping things under review, keeping things recorded, absolutely, and escalating that where you know you need to. Conversations with users and staff and children, parents. Yeah. So thank you so much for all those comments. That's really great. You've clearly I've got a good idea of where you would start with this quality indicator. I'm just having a wee look in the chat as well. We've got lots of good suggestions there too. So thanks very much, everyone. So we'll move on to the next part of it then. Okay, so for this worked example, we've went away for this imaginary service, and we have gathered all that evidence and that feedback. So that's for us to then answer question 2. So now we're going to move on to how do we know. So all the things you've said are all the things that are on here. So looking at policy and procedures and reviewing them and making sure that they were aligned with legislation and good practice. Doing a staff training audit, so making sure that staff had appropriate safeguarding training, so appropriate to their role as well, because you'll have different staff will need different levels of training depending on what their role is in the setting. Knowledge assessment, so looking at you know, they maybe had the training, but now they've also used the challenge questions during the development session just to test people's learning and make sure that they've been able to apply that to their practice and that they really understand what it means for them. Chronologies, so they've looked at 6 children's records just to see, you know, how are things recorded, have the outcomes been recorded, is there any follow-up actions that we're needing to do, have those been followed through. Looking at rotas, so evaluating those to look at the skill mix and the experience of staff, so making sure that that's a good mix across if it's in a take care of children setting in the room, or you know, just making sure that you've got that good mix and it's maybe not too many staff who are newer who are all working together, that you have a good balance there. Observations, so they've observed 8 children's play and learning and spoken with them, so obviously that would be age appropriate and it would be depending, they might have used different methods to do that. And to get partnership feedback, they've spoken with 1 social worker and 2 health visitors, so just using those contacts that are in and out of the service, people that are their key stakeholders that they can easily get feedback from. And for family engagement, they've collected feedback from 21 families and carers. So that's through a combination of surveys and also just having informal chats with people just at pick up and drop off times. So whenever they've done that, the next part that we need to do then is to take question 1, question 2 and think about, well, what have we learned from that? What have we learned from answering those first 2 questions? So in this setting, they found that most things are going well and they don't need to make any changes. So what we've tried to do here is show you some examples of evaluative writing, but there's not a lot of space on this slide, so we haven't been able to do it maybe as fully as we would have wanted to, but there are some examples there. So observations of children's learning and play showed we had a strong focus on promoting children's ability to keep them safe. So that's a good, strong evaluative statement there. Based on that evidence that they've gathered and that feedback, children had positive, trusting relationships with staff and told us they felt safe. Feedback from a focus group showed that the child protection policy and procedure was up to date. So I think somebody had mentioned about using, getting a group of staff to go through the policy together. So in this example, that's what they've done. Evidence from the training record showed that 90% of staff had completed the training. So they can be assured that most staff have got up-to-date knowledge of child protection, or at least they've completed that training. and they've got strong partnership working, which is helping to protect children. Again, a good strong evaluative statement there. So they know this because they've had a positive feedback from the social worker and health visitors about the protection referrals that they've made, and they've also submitted the notifications and the updates to the care inspectorate that they should have. So those are the things, those are the strengths and the things that can be celebrated in this setting. But there are some areas that could be improved. So when they looked at the chronologies, they didn't consistently track the outcomes of concerns, which could put children at risk. So they found that the recording systems, although the concerns were captured, 2 of the records hadn't evidence how the concerns had been actioned. So they weren't complete records, and there was maybe some things that were missing. Despite 90% of the staff having completed the training, whenever they did those discussions with the staff using those challenge questions, there were some gaps in their knowledge. There were some bits that they lacked confidence around, particularly recognising and reporting potential wellbeing and protection concerns. So that part about not really knowing how that training applies to their setting and that policy and procedure that's in place. 10% of staff hadn't completed training, and there were no plans in place for this. So that's something that's kind of slipped off the radar. Nobody's kind of monitoring it, nobody's picked it up. So that's definitely something that they need to tighten up on, because their systems around that aren't working as well as they could be. And the child protection policy could be more accessible to families and carers. So again, they know that because they've had questionnaire responses from families that have told them that they're not sure how to access the information. And some people have said that the policy document's too long and not easy to read. So you can see how that's kind of pulling all those threads together, like Sharon said earlier, about you get all that feedback, you get all the evidence, and then you have to sit down and look at the bigger picture and say, well, what does that mean? Use that so what question. What does that tell us about how we're performing, and what is the impact and the outcomes? So we're now going to, for this, we've used the 6-point scale that just to help measure it, and it's important to measure it just so that you know where you're at. You have a benchmark of how you're performing just now, but you can use that later and go back to it and revisit it to see if the changes that you make result in improvement. So on the basis of there are some strengths, but there are definitely some areas that need to improve. So for this service, the evaluation they've given is adequate for this quality indicator. So there's a bit of work to do to bring that up. So based on all of that, we would like you to tell us, what improvement actions do you think this service could take? So if that, just think about it for your own setting. You know, this isn't specific to any particular setting or service type. Just tell us, you know, what do you think this service could do? If this was your service, what would you do about the training, about the gaps in the staff knowledge, that policy not being accessible to families and carers? What could you do about that to make that better? The chronology is not being, you know, fully completed. What kind of things might you be looking at there to try and improve that, to make that better? I'll just invite Kelly to come back in as well. Okay, so we've got streamlined child protection policy. So yeah, maybe have a shorter version, an easier read version. Quality assurance monitoring for chronology. So yeah, maybe they have that in place, but maybe it's not working as well as it could be, and it's maybe a training need for the people who are doing the audits. It's maybe about how can we make sure that's more consistent. It's maybe about the frequencies. Upload the policy at the service website for families. Yeah, so make it really accessible. You know, it's not a physical copy, it's there, and it's they can go online and they can see it. So we've got staff training, simplify policy and share with families. Absolutely. Like, I think we're in a world now where we do need to make things more accessible. So just having that mind. It might be that, I'm sure probably somebody said this, but yeah, there we are, parent working group to review and update the policy. So if that's the feedback you're getting from families, involve them in it, get them to tell you what it is that they could be better about it and what it is that you could do. Anything jump out at you, Kelly?
I was just thinking there's nothing better than being actively involved in something to get an understanding of it. So involving parents in that is so valuable. People
Yeah.
have been putting training and seeing that as something that would be a priority. But again, thinking about there's the training and then that step beyond the training. So how do we evaluate the effectiveness of the training? Has the individual or individuals, have they got what you needed to get from that training? Is there other things that need to be put in place? Do you know, some individuals can go to the training, translate that into practice. Others might need a bit of support. So it's just considering some of that as well.
Yeah, I've just seen somebody saying in the chat on Teams 3-year training reminders, so look at annual refreshers. So that bit about having systems in place. So that's definitely something that we picked up here that maybe wasn't working as well. And there are lots of tools out there now to help us do all these things. Just need to learn to use them all. So staff training, yeah, people saying better communication, share the policy, see it as a priority. Absolutely. Send policy out to parents for feedback. Yeah. More easy read website. Yeah. Folder at the door. Staff insert days with focus on knowledge gaps. So using that protected time if you have it, you know, if you've got staff meetings, if you've got development sessions, you know, using that to reflect and to give people the opportunity to ask questions and discuss things with each other. Absolutely. Quality assurance needed updated. Yep, so we said change should be implemented immediately. Yeah, so it's prioritising getting that up to date. But I think, as Kelly said, you know, we'd need to look at what is that training and what are those gaps and what could we do around that to make that better for people. So lots of people saying about chronologies, training, sharing with stakeholders. Have staff evaluate their training. So whenever staff do complete their training, get them to do an evaluation as part of that as a routine thing, get them to do an evaluation, or just somebody had mentioned about quizzes, you know, having short quizzes, making things, you know, it doesn't have to be a huge big thing. It's just something where you can, there's an opportunity for a conversation a lot of the time.
This was actually mentioned in the chat earlier, Tracy, but I think it is probably quite helpful to share as a reflection for the improvement actions as well. Somebody had talked about reflection, so actually looking back at case studies or where you have had to act to protect a child, to actually reflect back on that, about what worked in that approach, and if there was any developments as well, and talking to staff about that.
Somebody in the chat saying some staff not been able to access refresher training, too few spaces, and that is an issue. But there are fortunately some more online resources that are becoming available that are free to use. So it's sometimes about just exploring what else is out there that's maybe more easily accessible. I can speak. Okay, so templates for given steps for chronology. So yeah, giving people guidance around it, that might be really, really helpful. Rings fence time. So it's about making sure they've got that protected time. A lot of the time, you know, we can have the best plans in the world, but things happen and it's picking that back up and scheduling it back in. Parent handbooks, yeah. Signposting for staff in WhatsApp where they can access, so having, yeah, communicating that with them and having it in a format that's easy for them to access to in terms of links and things. Book staff on training.
Quite a few people talking about reviewing their policy and sharing the policy at different points. But and thinking about accessibility, I was in a service recently and they were using QR codes as well. So just when a parent or a visitor was coming into the setting, you were to use the QR code and it just gave you the information about who was important to talk to if you became concerned about a child. So just making that really clear for people.
Mm-hmm. And making use of those wee opportunities that are there. Absolutely. Staff to complete and a fun quiz. Absolutely. Make it fun, make it engaging as much as you possibly can. So plan training for staff. Oh, somebody's mentioned there, Kelly. I think they must have read your mind. Display policy, perhaps a QR code for ease of access. Absolutely.
They may be thinking I was visiting their service.
Maybe.
It's maybe them I was visiting. But I
So
think that's
having
what's really good about these sessions is it's about sharing
others.
ideas as well, about what other people might do and are doing.
Yeah, there's loads here, absolutely loads. So you can see, like, from that one quality indicator, there's so many potential options in terms of that evidence and that feedback. So many things you could look at. So, you know, you can see how you could make it work for your service. Like, everybody's service is different, but the range that's there of options, there's definitely something that would apply to every setting, really. Okay, that's great. Thank you so much, everyone, for all your oh, somebody's saying there, Angus Council have a fab template for chronologies that's online. That's really helpful. Thank you for sharing that. So we'll move on next to the next slide. So what we've done here is just to give an example of what an improvement plan might look like. And actually the suggestions you have given are much better than what we have here. So that's great. We're not saying that you need to use this plan. Absolutely not. This is just to give you a visual of what it might look like. We would be looking, though, that you would identify an outcome and then actions that would help you to achieve that outcome. And you should have some thought around the timescales, who it is that might take that forward. And probably the most important part is about keeping that under review. So we don't, you know, you can make a really pretty improvement plan or development plan or whatever it is you want to call it. But if it sits on a shelf and nobody ever looks at it, then it's not going to help you to achieve the outcome that you want and make those improvements in your setting. So definitely important to think about resources that are available and make it achievable. You don't want to set yourself up to fail. You know, you want to make it that you're actually going to be able to do these things. And if you draw out the plan and you put all your actions in, and then you discover that actually we can't do those things, or maybe something's happened and there's change in priorities, and you think, well, we were going to do that this month, but actually we're going to need to do this. That's okay. Just reflect it in your improvement plan. Just show that something else is taking priority, but you're keeping under review, and you'll come back to it, you know, whenever that. Give yourself a date and give yourself an extended timescale. So that's just a wee visual. There's nothing on there that we haven't already covered. So there's lots of stuff there about practice scenarios, increasing the reporting system for the audits, staff training, observation. So what you had was a much more broad examples of evidence and feedback than we've got here. So a lot of the time, whenever we start to talk about self-evaluation, time is an issue. Like, people are quite, you know, they get quite anxious around it. They think it's an expectation, you know, from the Care Inspectorate or the Education Scotland that, you know, they have to be doing this, they have to produce it for us. That's not what self-evaluation is about. It's about you in your service, and it's about supporting your own improvement journey. It's not something you do for us. This is something you do for you. It's about how you keep your service under, you know, you're reviewing those outcomes, you're reviewing the impact of the things you're doing, and you're constantly, I mean, everybody always wants to make things better. Even when we're doing things really well, there's opportunities to strengthen things and to improve. So what we would say is, if you are struggling for time, or it is difficult, and sometimes it can be quite daunting, especially if this is not something you're already doing, it can be helpful just to focus on one area at a time. So we're not saying you have to take the whole framework and self-evaluate against it. That would be just about impossible. It's too big. But pick a key area and start there, and make it small and make it achievable. If you're in a setting where you're working with other people, get people who are interested in self-evaluation to support you. You'll know within your own team who those people are. Start small, start with a small group. Very often what happens is, when people start to see what self-evaluation and that improvement planning can achieve, then they want to become involved. But sometimes at first people are a bit apprehensive. If there is an issue in your service that you already know about, so maybe there's been an incident, or there's been complaints, or something's happened that's kind of raised your focus in an area, start there. You know, make that your first point of where you start your self-evaluation, and use that feedback that you've already got, or that evidence that you've already got around that issue, as your starting point. As we've said, use everyday opportunities to ask questions. So it doesn't have to be a new process or a new way of doing. Tap into those things that you're already doing and make use of those wee opportunities throughout the day and build self-evaluation into just what you do routinely. We've said already about using that information. So a lot of you've picked that up, audits, instant surveys. So the things you already do, just use what you've already got and start there and maybe adapt it slightly if there's bits that you need a bit more information around. Using digital tools and platforms. So a few people have said that in your suggestions. So making use of online surveys, using things like voting polls, using your social media for engagement and for getting feedback. And just whenever you're, participation with children, just building that into daily routines, just making sure it's optional and it's not going to interrupt their play, but just using those opportunities just to make it easier for you to take it forward. So I'm now going to hand you back over to Sharon, and she's going to just wrap that up and just give us a wee summary.
Thank you, Tracy. So as Tracy says, I'm just going to give you a brief overview. So this is just about pulling all those things together and helping you see where self-evaluation fits in and the cycle that actually takes in terms of improvement. So like we said, right back at the beginning, identifying your focus, keeping it small, as Tracy says, being clear about what it is you want to know, not taking on the entire framework, as your starting point, because that's never going to work. Finding out what is it that's really important to us right now to know about. And like I said earlier, and Tracy just mentioned some of those quick win kind of ideas. Is there something that you already know that you need to work on? Is there already something there in terms of improvements that you have identified? Use this approach, see the value in this approach, because it is really valuable. And I know lots of people talk about the time it takes. This saves time in the long run. Yes, while you're getting to grips with how it works, you might need to put in that additional time in terms of getting your heads around it. But this really adds value to your service, and hopefully by working through that you'll be able to see it. It makes a lot of those quality assurance activities much more functional and fit for purpose when you're actually kind of putting them into a bigger process as well. You'll find that you'll be able to make things really work for you. And like we said right at the beginning, that less paperwork bit, you might find you're doing lots of things that actually don't add any value to what you're trying to achieve and to making improvements in your service. So yeah, so starting there, figuring out what it is you actually want to focus on, making sure that you're able to gather all that information and evidence. And like I say, having those different things already working in your service, which most of you have, those audits, those interactions, those observations, making sure that you're able to gather those up, that they're working for you in a way you need them to do, so that you can make that evaluation of where you're at. Evidencing that assessment, using those evaluative statements, being clear about, okay, what's working really well for us, where do we need to improve, and getting to the point where you're able to develop that improvement plan. And again, going back to what Tracy was saying, be kind to yourselves. We don't need to see big fancy improvement plans, that just sit there gathering dust. Be small, be specific, use those SMART principles in terms of, be clear about what your outcome is. What is it you want to achieve overall, but break that down, make it achievable, and also being able to review it. Okay, if it's not working right now for you, that's okay. You're able to go away, change it, maybe priorities intervene and you can't carry on with that particular piece of work. That's okay, but record it in that sense. Don't make it look like, well, actually we started an improvement plan and we just never got round to it and it's just sitting collecting dust on a shelf. Keep it live, keep it working, keep yourselves on track. But like I say, be kind to yourselves and don't set yourselves up to fail by taking on too much too quickly. And that bit about assessing your impact, like we said right at the beginning, measuring yourself initially, but then coming back and measuring again to see, has there been an improvement? Did we make a change? And if we did, was it a positive one? Because sometimes, and we spoke about this before with training, sometimes it's not that obvious solution that we think it is. And when we do these kind of sessions, lots of people, their response to most issues is train the staff. maybe your staff are perfectly well trained, but actually they just don't have time, or they're not confident, or there's some other reason why they're not doing what it is that you would like them to do. So don't just assume that, you know, maybe putting in that action, for example, training will fix it. Go back, assess whether those actions actually resolved the issue and made that improvement. So like I say, just a quick overview. I'm mindful of time because I want to make sure that we get plenty of time for your questions as well. So just very briefly, there's resources available. We are kind of in the middle of developing further resources to help people out. These are very early stages. We want to make sure that they're fit for purpose and that they work alongside Education Scotland, so that, you know, we're doing something that's joint and giving you one set of information as well. So there are resources that are available now, but some more will also be coming. So just another little kind of test of the water to see, has this made a difference? Has this been helpful to you? This is one question. We will also share a QR code later that has a fuller evaluation on it. It's not huge, it won't take you long, but please do fill it in. We really need to know whether this is useful for you, whether there's other things that you need, whether we're pitching it at the right level. So please do tell us, please do give us that feedback in the other evaluation form, and we'll put those links out to you in a minute. Like I say, in terms of us being able to support you on your self-evaluation journey, but also, you know, around the framework, we need to know what it is that you need from us and whether we're actually pitching that at the right level for you as well. So please do take a few minutes to fill that in. So just give people a second. I think most people have gone in and voted on that. So we're just going to do some Q&A now. So the QR code should come back up for people. So you can actually type questions in to the AHA slide, and you can also use the chat, and we'll bring Kelly and Tricia back in as well to answer some of those questions for us. So will amendments changes be evident on the online document? Are you talking about the framework? I suppose it would be my first question.
And if you are, the answer is yes. We'll let you know any changes that are going to be made to the framework. What is Samoa? That is the Keeping Children Safe campaign that we ran, that was about the supervision of children, and Samoa is the elephant emblem that goes along with it. So we've got practice notes around transitions, supporting challenge, and for settings thinking about their outings as well, just to how they would keep children safe during these.
Someone asked there about sessions being more aimed at childminders. It's disappeared, but I saw it a second ago. We have discussed that, and I think there are discussions ongoing with SEMA. Kelly, is that right?
Yeah, no, there absolutely is. We've been linking with SCMA and trying to run sector-specific sessions where we can as well. But if you want to share that feedback with us formally, it helps us to have evidence to be able to justify continuing to do that. So please do.
Will there be a self-evaluation template developed for ELC? So we're in, like I said, we're in the midst of trying to develop that. So I know a year or so ago, there was some templates and our self-evaluation toolkit that went out to providers for a test, but obviously then the focus was shifted onto the shared framework, and we don't want to put something out without that being something that's valuable for both ourselves and education, but also making sure that we're not sort of overburdening people with lots of different things. So in progress would be the answer to that.
And like Shannon had said there earlier as well, very much linking with SCMA. So for childminders, they have a self-evaluation toolkit that's not long been released based on the current framework, and they are thinking about how they will update that to reflect the new framework as well.
Just noticing throughout the chat, and I know that some of the answers have been, or some of the questions have been answered, but there's a few questions about knowing what quality indicators Care Inspectorate or Education Scotland will look at. So there's as Sharon just said, there's a lot of ongoing discussion just now in terms of our methodology between both organisations, and that's something that we hope to put out. I think someone had asked, will it be out before the summer? And we're hoping that by the end of June that we will be able to share the proposals for moving forward.
I think somebody's
and
also asked. Sorry, Kelly, go ahead.
I was just going to say, and when that's been confirmed, we'll be communicating that with people. We'll have further sessions to keep people up to date.
So someone else is asking about the PDF of the digital framework. So there's currently a PDF that can be downloaded, but what we would ask is that you wait until nearer September. Because of the pilot, we've had feedback on areas such as challenge questions, maybe just making them a bit shorter. Also, there'll be minor tweaks that we've had feedback about. There won't be wholesale changes. The headings will stay the same. The QIs will still be there. However, there might be slight changes in language. So we would like to think that that will all be done and ready to be shared just prior to the launch. But what we will do is we will make sure that whenever we make any changes, that's communicated out clearly to everyone in the sector, and that we have a version control so that if there are changes made as we move forward, then people will be made aware of that. However, as I say, we don't expect it to be huge changes.
Someone else is asking there about links and resources being in the new framework, as they find the current ones very helpful. I think we talked about that in the earlier webinar, and we say there will be links and resources. I don't know, Kelly and Tricia, what that looks like.
Yeah, we started to hyperlink some of the resources throughout the text, but we're working with the content designer to make sure that it's not overwhelming for people. So it may well be that there's links in terms of resources. We're still discussing that to see what would work for people, because I believe in terms of that accessibility, we don't want every part of the document to be hyperlinked, or people will just be constantly clicking on links to resources. However, we've said from the very start that it will be incremental, but that is the plan, that we will work through that. And again, we're taking on board ideas that we're hearing back in terms of how useful that would be and what that should look like.
And it's in the current framework just now, isn't it, Tricia? So it's in where we think it's significant to guide people to other best practice if they want to do a deeper dive in a particular area.
Somebody also asking whether the amendments that will be made to the framework, will they be highlighted in any way on the digital framework, making it easier to track?
I think what we've spoken to the content designer to make sure that when we do make changes, that we are able then to communicate that clearly to everyone in the sector.
Okay.
Someone's put ignored typos, and I'm sure you're talking about this, but actually we did spot a typo in the framework as well, and we're looking to address them.
Yeah.
Somebody had put a question around the difference between Care Inspectorate coming in and Education Scotland coming in. So would education be looking at both parts of the framework? Would Care Inspectorate just be looking at Care Inspectorate parts? I think that was the question.
You'll notice in the current digital version that at the top of each quality indicator, it does state this quality indicator is a Care Inspectorate quality indicator, or this quality indicator is an Education Scotland quality indicator. So hopefully that's helpful for people.
Okay.
When will this framework be used in inspections? So both Care Inspectorate and Education Scotland will be using it from September this year.
So quite a few questions that are covering some of the things that we've already talked about. Like I say, you know, we won't get a chance to answer all of these questions, but we will be producing a frequently asked questions document. And as I said right at the beginning, we will send out a copy of the slides and also the recording and the frequently asked questions. So a whole barrage of things in the provider update. Depending on the dates that that comes out, I'm not actually sure when the next one comes out, but it might be the next one or it may be the one after that. The 6th of June is in my head for some reason, but I'm not entirely certain. So I also see that Vicky has put in the Microsoft form link into the chat for people to fill in. So just before everybody starts running away at the end of this, please, like I say, do take that time to fill that in. And like I say, hopefully we'll be able to answer all of your questions in that frequently asked questions document. So I'll just pop up, there we go, the QR code there for the evaluation form for us. So like I say, please help us develop these further and make sure that we're delivering what you actually need and want from us. Thank you so much for taking time out of your very busy days. We appreciate, you know, that people are very, very busy. So thank you very much for making the time to come. And I hope that's been useful for everybody. Okay, thank you.
Thanks, everyone.